Hi, everybody. It's Kim West, the Sleep Lady. And on today's episode of the Gentle Parenting Show, I am so honored to have Dr. Elisa Song. Welcome. I want to read to you because this is a very impressive woman here. She is an integrative pediatrician, a pediatric functional medicine expert, and a mother. In her integrative practice, Whole Family Wellness, she's helped thousands of kids get to the root causes of their health concerns and help their parents understand how to help their children thrive, body, mind, and spirit by integrating conventional pediatrics with functional medicine, homeopathy, acupuncture, herbal medicine, and essential oils. She also created Healthy Kids, Happy Kids as an online holistic pediatric resource to help practitioners and parents bridge the gap between conventional and integrated pediatrics with an evidence based pediatrician backed approach. Wow, are you so needed? And boy, do I wish you were around when my girls were little.
Oh, thank you. I'm honored to be on with you and sharing with
Mhm.
your audience. And I love that we're wearing matching colors.
That's right, because we're both springs, I
We are
think, right?
colorful. That's right.
So, as you can imagine, listeners, we could have Dr. Song on this podcast for hours and hours and talking about all the different things. But I thought I would focus first because on basically, what I'm working on right now is my next book, helping new parents of babies 0 to 5 month olds.
Yeah.
And, some of the common things that parents talk about, of course, is, colic, reflux, constipation, anything, feeding, eating, of course, that all then disrupts sleep. And they're all looking for also like natural approaches,
Hmm.
especially as we're finding out more and more about the effects of you know, reflux medicine, for
That's
instance,
right.
on
That's
children.
right. I mean, it's
So,
so important because, first, I always start off every conversation with moms first by
mm,
saying, whatever's happened in the past, we can figure out how to undo it. We can move forward.
yeah,
So if your kids have already been
mhm,
on different medications and you're thinking, oh my gosh, did I mess things up? I mean, don't, right? Because we as moms, right, Kim, you
mhm,
know this, right? I mean, we have
mhm.
so much to feel guilty about. And
Oh
so we
gosh,
don't want to go back and second guess ourselves. We only knew what we knew at the time, right?
yeah,
But now we know more and we want to move forward. And
mhm,
so, we do know now that the baby's gut microbiome, it plays the most important role in establishing their brain development, immune health development, hormone development, and sets the stage for future health and wellness. Disruptions
mm,
to the gut microbiome in infancy, starting from the newborn phase, have been associated with virtually all chronic kids' health conditions, whether it's
mm,
anxiety or depression or, ADD, autism, autoimmune illnesses, eczema, asthma, you name it, all the things that we're kind of ticking off and are seeing so much more commonly. And
mhm,
one of the things that we know, I mean,
mm,
food allergies are crazy on the rise, right? These really,
mhm,
severe anaphylactic food allergies, but also more allergic diseases like eczema and asthma. And
yeah,
there was a huge study a couple of years back, nearly 800,000 kids, they were in the military, and they looked back at charts and
mhm,
identified babies who had received either antibiotic medications or antacid medications in the first 6 months of life, and they followed them out. And what they
mm,
found that by the time those kids were 4 years of age, they had a significantly increased risk of pretty much every allergic disease, whether it's anaphylactic food allergies or hives or eczema or allergy or hay fever. And
mm,
so, we want to take a step back. The authors at that point noted, and they're very
mm.
conventional authors, this was a JAMA Pediatrics article, noted that, possibly it was due maybe to the shifts in the baby's gut microbiome and how that informs the baby's developing immune system. Well, in functional
Mm.
medicine, and even actually, I would say going back centuries to not just Hippocrates, but to traditional Chinese medicine, um, the foundation of health was known to be in the gut. And so that's where we want to make sure that no matter what we're looking at, whether it's, colic or gut symptoms like reflux or constipation
Mhm.
or diarrhea,
Mhm.
or other things like, behavioral problems or, eczema or
Mhm.
anxiety, that we always start with the gut. And so, that's
Mm.
my passion, is to teach parents, how do
Mhm.
we undo whatever's been done in the past?
Mhm.
Or
Mhm.
let's say if your child hasn't had antibiotics or antacids, how do we prevent disruptions from happening? And that's my
Mm.
passion and mission, right? Is to really help
Mhm.
parents understand how to help their
Mhm.
kids thrive from the whole body standpoint, starting with the gut.
Hmm. And I know there are some, even if I look at my two girls, my younger one had to get antibiotics because I was beta strep positive or
Yep.
whatever it was.
Yep.
So she didn't even have a choice,
That's
right?
right. That's right.
Right
And
out.
and I
Yeah.
would never say don't get the antibiotics for group B strep, because it plays
Right.
such a critical role in reducing the risk of your newborn having a serious infection. Um,
Yeah.
but here's the thing. I mean, even for my kids, as a holistic pediatrician, right? What I tell parents is, um, there is a time and a place for everything. And that's why I really moved away from saying
Hmm.
holistic to more integrative, because we
Yeah.
don't want to throw the baby out with the bathwater. We want to take the
Yeah.
best of all worlds and really take
Hmm.
that evidence-based approach, and also understand that, there are um, positives, benefits. I mean, antibiotics can be life-saving, but there are also unintended consequences, like shifts in the
Right.
gut microbiome, that we need
Right.
to address. And, my
Right.
babies, I mean, Kenzie, when she was 2 weeks old, as a little baby,
Hmm.
I mean, she developed a UTI, and
Wow.
she was really jaundiced. And
Hmm.
that was our tip off that something was going on, because babies usually don't start to get jaundiced at 2 weeks
Hmm.
of age, right?
Yeah.
Um, and so, you know, did I do I wish she didn't have antibiotics? Yes, but at 2 weeks of age, am I going to say no to the antibiotics? Definitely not, because we don't want that
Right.
infection to get more serious.
Hmm.
And then my son, when he was 4 weeks old, he started developing this greenish drainage from his ear. So unusual. He was
Hmm.
happy as a clam, feeding fine. But then
Oh.
it turned out that our cousins who were visiting, had strep throat. And so I checked Bodie. Brought him to the doctors, because you don't want to be a doctor to your own kid. So I brought him
Right.
to the doctors, and we took a culture of reserve food, and it was strep, the same strep. So we gave
Wow.
him antibiotics. And
Right.
remember I said that the study showed that antibiotics in that first 6 months of life increases your
Hmm.
risk for all allergic diseases. Well, my kids
Right.
don't have any allergic diseases, knock on wood, right? No
Right.
eczema, no asthma, no hay fever. Well, a little hay
Hmm.
fever for Kenzie. um,
Hmm.
but it was because, as an integrated pediatrician and functional medicine pediatrician, I knew, okay, these antibiotics are needed. I also know it's going to disrupt the gut microbiome. So let me do things like giving extra probiotics, me
Hmm.
taking probiotics while I'm nursing, making
Mm.
sure that the babies are getting enough, and I'm getting enough zinc and glutamine, so they can get it through my breast milk, so that we can restore their gut
Mm.
microbiome. So there are always ways to mitigate. We just need to know first, right? That's,
Hmm.
knowledge is power. So we just
Right.
move forward with knowing how to support our kids.
Hmm. Oh, that's great. I didn't know that. In addition to probiotics, so that makes sense then, and is a great relief about the antibiotics, because as you pointed out, sometimes we have to.
Yeah.
You know. So what about? So let's go back to reflux,
Hmm.
and if your child is experiencing reflux, and are there things you can do other than antacids? And then what if you went on an antacid and now you're off of it?
Yep. Yeah. I mean, 100%. And I'll say, when we talk about reflux, it's often interchanged in these early periods, right? Because now we're
Yeah.
talking about the 0 to 5 months of
Mm-hmm.
age, right?
Mm-hmm.
Where maybe your 2 week old or your 3 week old is diagnosed with reflux because they're
Mm-hmm.
really spitty. I mean,
Mm-hmm.
my daughter, Kenzie, I mean, she would have these. I don't like to use the word projectile
Mm-hmm.
lightly, but I would see her in the baby monitor sleeping on her back, and she would have like these volcanoes of like
Mm.
milk gushing
Yeah.
back up, and she'd be screaming. I'm like, oh my gosh, does
Oh.
she have the worst reflux, or what's going on here? So
Mm-hmm.
it turned out
Mm-hmm.
that and I worked with my lactation consultant,
Mhm.
I had too much milk. I mean, I had so much milk with
Mm.
Kenzie that,
Mhm.
when I was feeding her, because I was ready to give up the breastfeeding, because I'm like, oh my gosh,
Right.
when I give her a bottle of pumped milk, there's no difference. When I nurse
Mhm.
her, it's horrible. And so she said, let's weigh her before and after each feed. I mean, one feed, and she was a voracious eater, really fast, 12 ounces she
Wow.
gained. I mean, for that tiny little stomach, no wonder it was coming back out.
Right.
So we want to think, okay, could there be something
Oh.
else going on besides just
Mhm.
reflux, right? I mean, there are lots
Mm.
of different causes for that, right? Most people,
Hmm.
though, they think of reflux and maybe their pediatrician has diagnosed your baby with reflux because not only are they spitting up a lot, maybe
Mhm.
forcefully, but they're
Mhm.
really fussy, right?
Yeah.
And they're really
Yeah.
uncomfortable. Maybe they're arching their back.
Yeah.
And that
Mhm.
coincides too with the kind of colicky phase that some babies go through. And we
Mhm.
know that there is a gut component to colic because when they've looked at stool analyses from babies with colic compared with
Mhm.
babies who weren't colicky, those colicky babies have a higher level of an inflammatory marker called calprotectin in their stool. So there's
Mm.
something, right? There's definitely
Mhm.
something. Um,
Mhm.
and
Hmm.
so, but we want to kind of look at it as a whole. And I always try to get to some of the root causes of that reflux. And there are definitely things that we can do. I mean, I have not had to put any babies on antacid medications since I've started taking this integrative approach. So there is hope.
Wow.
Okay. So the first thing is looking at mama's diet. Right,
Mhm.
because if your babies are nursing, or if you're formula fed, right, for some moms, it's not an
Mhm.
option to nurse, or
Mhm.
maybe they're
Mhm.
supplementing. But there are some foods that are going to be much more inflammatory to that baby's gut. And the number one is going to be cow's milk products. I had one mom
Mhm.
where, the only cow's milk product she had was a teeny splash of creamer in her coffee. And
Yeah.
it wasn't until she gave that up and moved over to, coconut creamer that the baby also was like, oh, I'm so happy, right? No
Huh.
more arching and no more spitting, right?
Right.
Um, and there are other foods. So if the baby's really, really
Mm.
fussy and spitting up quite a bit, um, I'll have work with moms to figure out what it could be. Now, let me step back for a moment though and say that
Mhm.
reflux is not
Mhm.
always pathologic. Okay.
Mm. Mhm.
All babies have reflux.
Yeah.
All. They don't all have reflux disease, and there's a big
Mhm.
distinction. Okay,
Mhm.
because that the sphincter, so you have your
Mhm.
esophagus where the food comes down, and then you have your stomach, and that
Mhm.
little sphincter muscle between the stomach
Mhm.
and the esophagus is very
Mhm.
loose, just like your baby's kind of loose and floppy, right? And so
Right.
that muscle is just open, and the food from the stomach just sloshes back up and back in and out really
Mhm.
easily. And sometimes it comes
Mhm.
out, and you have the spitting up. And sometimes it stays, but it's still there. So reflux is
Mm.
totally normal. And it's really only until about maybe 3 or 4 months of age where that lower esophageal sphincter muscle starts to tighten up, right? That coincides
Mm.
with your baby. They're more coordinated. They can
Right.
reach for things, right? They
Mhm.
can hold on to things with more
Mhm.
force. And so, and
Mhm.
their head control stronger, all their muscles are strengthening up. Same thing with
Mhm.
that lower esophageal sphincter. So after about 4 months of age, all of a sudden you're like, oh, the reflux is gone. They're not spinning up
Mm.
anymore. I don't have to
Mhm.
carry 20 bibs with me, right? And like,
Right.
10 changes of clothes for the baby
Right.
and for me, right? Which is what I did with
Exactly.
Kenzie, right? So we don't want to call every bit of spitting up pathologic.
Mhm.
But if they're really
Mhm.
fussy or
Yeah.
it's interfering with their feeds or possibly interfering with their weight gain, then we need to step in. So the first
Yeah.
thing I look at is mom's diet, and I'll just for a week, it typically takes about 3 to 4 days for food antibodies and sensitivities to really reduce. So about a week,
Mhm.
I'll have her eliminate um, cow's milk, gluten, soy, eggs, and corn are kind of the big five, right? I
Mhm.
always, though, because I never want a mom to feel hungry or restricted, right? Or more
Mhm.
stressed out with this. So I always focus on what she can eat. Really, any fruit, any vegetable, except if she's gorging on the broccoli, then maybe tone that down a little bit, or
Right.
tons of beans, right?
Right.
But any lean meat, right?
Mhm.
Non-gluten grain. So really focusing on what you can eat
Mm.
and how healthy that can be for her and for the baby, instead of
Mhm.
focusing on what I can't eat, right? Because we don't want this to be a stressful
Right.
period. So after about a
Yeah.
week, maybe 2 weeks, we kind of, clear the foods from her system and from the baby's system. And
Mhm.
then we can introduce back one by one, right?
Mhm.
Just like, let's say it's cow's milk, right?
Mhm.
Creamer in the morning, maybe a little, cheese at lunch, a quesadilla on a gluten-free tortilla, get a cassava tortilla, and
Mhm.
then at
Mhm.
dinner, maybe cheese on her salad, right? And then notice
Yeah.
for that night or the next day, is the baby really more fussy or gassy or spitty up? And then we know,
Mhm.
oh, okay, cow's milk is an issue right now. I'm going to keep it out of my diet for now. And I say for
Mhm.
now because it's not forever, right?
Mhm.
It's while your
Mhm.
baby's gut is maturing and they're able to handle these foods a little bit better. So that's one
Mhm.
thing, right? Because there could
Mhm.
be a food component to it. Sometimes it's just more of a mechanical component, like the overfeeding that Kenzie was getting, right?
Mhm.
So
Mhm.
what I did with Kenzie was literally, I just, because she would hang out on my breast as long as, for hours if I let her. So
Right.
after 10 minutes, I'm like, okay, you're done, right? And then
Right.
I started, and the spit up stopped, right? The
Hmm.
fussiness stopped. And then you just keep
Mhm.
them upright, right?
Right.
Head up, after they feed, whether it's on you or in their
Mhm.
little chair, and just let the food settle down. Right. And I would
Mhm.
even do that for about 5-10 minutes before you try to burp them so that the air bubble can go to the
Mm.
top of the stomach, the food is below, and when they burp, they just burp out air instead of burping out all that food that's mixed in with the air,
Oh, that's
right?
a good little
hmm
nugget. Mhm.
Um, Now, in
Same
terms
for
of,
middle of the night feedings?
yeah, yeah, you can. I mean,
Mhm.
now you
Mhm.
might be so exhausted that you're just putting the baby down,
It's
but
hard. Yeah.
yeah, if you can, for sure, keep
Mhm.
them up a little upright. If you're, in your rocking chair, and you
Mhm.
can just hold them a little bit without falling
Mhm.
asleep, right? And then
Mhm.
and then
Right.
burp them, right? Um,
Mhm.
and then, the next step is, what do we do for the baby, right? And so
Yeah.
in other cultures, there are herbal teas that moms drink and babies actually get too.
Mhm.
In Indian tradition, there's an herb called ajwan. There are little ajwan seeds, caraway seeds that are really good
Mhm.
for digestion that moms can drink. But chamomile tea
Mm.
is great. So bring a whole pot. It's also great for the nervous system because you might be stressed if
Mhm.
your baby's colicky.
Mhm.
So moms can
Mhm.
drink that chamomile tea, but also babies can get that chamomile tea. In fact, there is an herbal combination of chamomile, fennel, um, lemon balm, and a couple of other herbs. It was an old Italian study, but they
Uh-huh.
gave that to babies who were really
Mm.
fussy and colicky and found that it significantly reduced those GI
Hmm.
symptoms, right?
Hmm.
Um, then, of course,
Interesting.
probiotics, right?
Mhm.
Probiotics. Oh, let me back up. No honey for the baby, though, right? You can have honey
Right.
in your tea as moms, but not for the
Mhm.
baby. Um, Probiotics always helpful, especially, let's say if you had group B strep and, you
Mhm.
had antibiotics around the time of the delivery, or
Mhm.
the babies needed antibiotics or antacid
Mhm.
medications already, right? If they're already on.
Mhm.
Um,
Mhm.
so lots and lots of different probiotics. And I
Yeah.
typically use a broad baby probiotic, but there's
Mhm.
one particular strain that has really good studies for the colicky, refluxy, fussy stage, and
Mhm.
that one is called Lactobacillus reuteri, Reuterii. So Lactobacillus reuteri, and that one, there's different companies who make just that. Um,
Mhm.
BioGaia is one,
Mhm.
Biogaia. But Gerber actually has one called Gerber Soothe that's just the
Mm.
Lactobacillus reuteri in a probiotic. It comes in an oil drop that you can just put on your nipple or on your finger, and the baby can suck off. So that's one thing. And
Mm.
then, I am a huge fan of teaching parents how to use acupressure for their babies, because
Mm.
acupuncture is amazing for kids. But
Mhm.
moms and dads can learn how to use acupressure points at home to stimulate those same points. And then I love
Mm.
homeopathy. And if people aren't
Mhm.
familiar with homeopathic medicines are,
Mhm.
there you might see, at Whole Foods, like these little blue tubes. And you're like, what are those
Mhm.
blue tubes, right? But
Mhm.
they're homeopathic medicines,
Mhm.
and they're so safe and gentle yet effective.
Mhm.
And they're often my first go-to
Mm.
for babies and for pregnant and breastfeeding women, because they really don't have any contraindications. And even if you're on other medications or herbs for whatever reason, there's no interactions. So In terms
Mm.
of the acupressure points, I'm looking down because I usually have I used to teach infant massage, so I usually have my baby down here next to me, but I put my baby doll in the other room. So I'm just gonna, I can't demonstrate for you, but there's one point that's really, really good to use. So if you just notice, I'm gonna stand up a little bit where the end of the rib cage is and the belly
Mhm.
button, and then
Mhm.
halfway in between. Okay,
Mhm.
that point is called CV12. And you can Google where CV12 is. But that point, while
Mhm.
you're holding your baby and nursing, you could just put
Mm.
your fingertip on CV12 and gently just put pressure on or massage a little bit. And that's
Mhm.
completely fine. And that actually helps to keep the food down, bring it down. That's probably the number one
Mm.
point to use. And I actually, when babies come to me for acupuncture, and I do acupuncture babies too, that's exactly
Mhm.
where I'll put that tiny little acupuncture needle and stimulate that point. And it can be
Mhm.
so calming.
Hmm.
There are other points too, but I don't want to, overwhelm you guys. But that's a great point to use.
Love that.
Essential oils are fantastic. Now we do have to be cautious with essential
Mhm.
oils in little babies, so I don't often,
Yeah.
have babies use essential oil. But there is one that is very safe and gentle. Well, two
Mhm.
really, I think at any age. It's lavender and chamomile essential
Mhm.
oils, right?
Mhm.
So lavender is very calming, relieves
Mhm.
discomfort and pain, reduces inflammation. So you could even put a little drop of lavender essential oil on your fingertip, and as you're holding CV12, just kind of massage it into that point. That's another way to kind of activate those acupressure points. And then there are several kind
Huh.
of homeopathic remedies to try. And the
Mm.
first one that I would try is a combination one by Boiron, and I'm gonna have to remember what the name of it is. It's called it's called Colic Comfort. Okay,
Mhm.
so
Mhm.
and that one it's really easy because it comes in these little liquid packets that you just
Mm.
twist off the top, and you can just squirt into the baby's mouth, and that
Mhm.
you can do it as often as you want to. So for really fussy, refluxy, or colicky
Mm.
babies, I'll just
Mhm.
have moms put the little packet squeeze into their mouth before each feed to see, can we settle things down and not have the end of the feed, or the hour after the feed be really uncomfortable.
Yeah. Wow. And so, wow, I know I said this in the beginning. I wish you were around when I had my my kids, but nobody was doing this. Not that I know of 24 years ago. Because my second daughter had silent reflux,
Mm,
and she got to the point where was stopping eating.
yeah,
And
yeah.
so then we had to give her medication. Even then, it took a long time to get it better. But wow, it would have been great to have all of these other resources too.
And
Yeah,
sometimes, Kim, sometimes despite our best efforts, babies will still need some medicine, right? I mean,
yeah,
and that's not
yeah.
like, I never want any mom to feel like that's a failure on their part. It is
Right,
what it is, right?
right.
We do our best, and
Mhm,
sometimes
mhm,
medications are still needed. I will say that when you
mhm.
take that kind of integrative functional medicine approach, you can get really good outcomes. And
Yeah,
oftentimes, babies won't need the medications, or your
yeah.
toddlers or your children or your teenagers, won't
Right.
need the medications. But
Mhm,
sometimes we do. And so,
mhm,
I guess this
mhm.
would be a good time to talk about, like, what do we do if they do need medications, right?
Yeah.
If
Mhm.
they do need antibiotics or antacids,
Yeah.
knowing how important it is to keep that gut microbiome healthy.
Yeah.
I mean, they've even linked changes in the gut microbiome to babies' temperament, right? And to,
Wow.
babies and to toddler behavior. And so,
Wow.
if your toddlers are throwing crazy tantrums and you're like, what is
Mhm,
going on?
mhm.
Look at their gut microbiome, or just do some gut
Hmm,
work, right?
hmm,
But
hmm.
we mentioned probiotics, and definitely you want to use, when it comes to keeping the gut restored. We have
Yeah.
trillions of bacteria in our gut, and we
Mhm,
have so many different strains of bacteria and yeast and even viruses and parasites residing in our gut, in kind of hopefully a healthy community, right? Living
mhm,
together in
mhm.
harmony. Um, so when we need medications, it doesn't make sense to just put one strain back in. right? So that's
Yeah.
where I really look for a probiotic that has a lot of different strains. And
Mhm.
there are probiotics that are made specifically for babies from about 0 to 2, maybe 3 years of age. Your baby's gut microbiome is rapidly shifting and developing. And then
Mm.
after about 2 years of age, it takes on an adult type composition. And so if you have a household of kids and adults who are all over 2 years of age, then you can all get the same probiotic, right?
Mhm.
But for
Okay.
kids under 2, infants through like early toddlerhood, I
Mhm.
would try to use a baby specific probiotic. And there are several on the
Mhm.
market that have a good variety of um, different kinds of lactobacillus and bifidobacter species,
Mhm.
and a
Mhm.
good colony count. So, I mean, for most babies, I think 5 to 10 billion colonies, um,
Mhm.
colony forming units per serving is a pretty good
Mhm.
range. Sometimes,
Mhm.
if they're using antibiotics, I might do more, like 10 to 25 billion.
Mhm.
And I'm saying
Mhm.
billion, not million. Um,
Yeah.
so, so that for sure is something to incorporate. Always making sure that you, as a mom, also that your gut microbiome is supported too. And then there's
Mhm.
amino acids that are found in your breast milk, like
Mhm.
glutamine, and
Mhm.
naturally. And they're gonna, if you're formula feeding, there it's going to be a formula too. But you might want to add, just you could just if you're nursing, just take a little extra glutamine, take a little
Mhm.
extra zinc. I mean, those are the two
Mhm.
nutrients that are really
Mhm.
important for keeping the gut lining healthy. Um,
Mm.
if your baby is getting formula, there's probably adequate zinc in there, but they might
Mhm.
need maybe a little teeny bit of glutamine. But before giving supplements to a baby, I definitely work with an integrative practitioner. But those are the things, especially if they're older, that I'll kind of incorporate.
Mhm. Wow, that's so amazing and helpful. And I'm imagining that constipation, you'd bring it back to this too. Constipation
Yes,
and diarrhea, right?
for
All back
sure.
to the gut.
Yeah.
Mhm.
Yeah. So, I mean, all these
Mhm.
same principles apply, but I will say with constipation,
Mhm.
now, constipation is a little more challenging to define in newborns because
Mhm.
um, exclusively breastfed infants, because
Yeah.
breast milk is so easy to digest and
Yeah.
absorb that
Mhm.
sometimes babies
Mhm.
with who are breastfed, they won't poop for days, right?
Right.
I mean, that was
Mhm.
Kenzie. She
Mhm.
wouldn't poop
Mhm.
for, I mean, it would be like 5 6 days,
Mhm.
but her belly was nice and soft and flat. She still was
Mhm.
feeding normally. She didn't have an increase in her spitting up, and she was totally
Mhm.
comfortable. And then she would
Mhm.
let out these like massive, like soak through the diaper and the clothes and
Right.
the car seat and the,
Right.
everywhere, right? Like
Right.
once a week. Which did happen one time when we were on a plane. I was dreading. I'm like, oh my gosh, this is day 6. I hope she doesn't do it on the plane. And of course she did.
Have a blowout, of course. Of
um,
course.
but yeah, but I will say
Mm.
that with constipation, the number one
Mhm.
food culprit is cow's milk, the number
Mm.
one. Okay.
Mhm.
And
Mhm.
then the acupressure point that you're going to use to help your babies
Mhm.
are going to be large
Mhm.
intestine 4. And that's if you take, go to the web space between your index finger and your thumb right here. It's
Mhm.
this point right here that you're going to push down. You could even take your
Okay.
thumb and just kind of gently massage this point. Okay, that's large intestine 4. That's the kind of down and out, great for headaches, good for fevers, good for constipation.
Wow. I
The
can't
other thing,
wait.
as we're thinking
Mhm.
about constipation, right? Because what happens with, in the toddler age, I mean, constipation is a whole
Mhm.
other story. And you
Mhm.
definitely don't want your babies constipated when you're trying to potty train. That's a like, no, we want easy, soft, no
Mhm.
fear poops, right?
Yes. Yep.
But constipation as we get older is
Mhm.
often related to um, like an increased stress response, right? And
Yeah.
I don't want to label
Mhm.
kids as having anxiety, right? Because we don't,
Right.
stress is normal and healthy, but we need to manage
Mhm.
it.
Mhm.
But that stress response, your sympathetic nervous system goes up, right? The fight or flight goes up in that normal
Mhm.
response to, okay, what's going on? Am I safe?
Mhm.
Let me figure out what's going on. And
Mhm.
with that, your
Mhm.
digestion slows down, right? Your parasympathetic nervous system, the rest,
Mhm.
digest, and heal parts stops, because if, you know,
Mhm.
in the caveman days when we're running away from a
Mhm.
saber-toothed tiger, you're not stopping to eat a sandwich, right? And digest it.
Right.
That slows down. Your muscles tighten up because you're getting ready to run, and your
Mhm.
sphincter muscles, your anal sphincter muscles tighten up,
Mhm.
right?
Mhm.
And so a lot of times with stress,
Mhm.
as adults, I experience
Mhm.
this when I'm stressed. I'm like, oop,
Mhm.
what's one of the first things to go? It's the pooping, right? The
Right.
constipation. But that
Mhm.
also ties in with, you and I have been talking offline a little bit before we started about how in the whole kind of colic reflux picture, we're
Yeah.
not, what's not brought into the conversation often enough is this stress response piece,
Yeah.
right? And the
Mhm.
stress response piece in the babies and in the moms. And
Mhm.
right
Mhm.
right now as moms, when we have our babies, we're not as supported as we could be, probably, for a lot of us, right? We don't
Mhm.
have our extended families, our mamas and our grandmas and our aunts
Yep.
and our sisters all here helping us with community, and we're kind of
Mhm.
alone, and many of us have to
Mhm.
go back to work in a
Yeah.
month, and you're just and maybe you have a toddler at home,
Right.
right? and
Right.
and maybe you're trying to, like I did, don't do this, but I was trying to catch up on all the work in the office still, because I have my own business, own practice,
Right.
doing all this work. I'm like, oh, I can do it when the baby's sleeping, right? So
Right.
I was just in this like adrenaline mode, right?
Right.
And I was so jumpy, right, at everything, and really
Yeah.
irritable with Peter. And
Mhm.
when he left for a weekend to help his
Mhm.
mother out, I
Mhm.
remember that whole weekend. It was like I was on pins and needles. I didn't shower. I hardly ate, because I'm like, oh my gosh, what if Kenzie starts crying? What if this? What if
Right.
that? And it was this. And I look back, I'm like, that was not okay. That back then my brain was not
Right.
working okay. My stress response was elevated. And of course, that was one of the times when, Kenzie was the most refluxy, spitty,
Mm.
fussy, right?
Mhm.
Because
Mhm.
all of those stress hormones, the cortisol and the adrenaline, they're going to
Yeah.
pass through the breast milk too. Right. And the
Mhm.
babies are going to
Mhm.
be kind of like this, just like you're like
Mhm.
this. Right.
Right.
So
Right.
taking that time for self care, to take that warm shower, to have a nice meal, to, if you
Mhm.
go for a walk, leave the
Mhm.
baby at home, with your
Mhm.
partner, is
Mhm.
so important, not just for you, right? But it's
Yeah.
really important for your baby, because a lot of times moms, they'll put stuff aside for themselves, but if you know
Mhm.
how important it is for your baby, it to be um,
Mhm.
mindful and present for yourself, then it makes it more of a priority, right? So
Yeah.
that, and then think about it. What happens when you're walking in nature? The
Right.
endorphins are released, right?
Mhm.
This feel good
Mhm.
chemicals. Your
Mhm.
serotonin goes up. Better than in
Mhm.
antidepressant medicine, they found, right?
Mhm.
And so all of those good chemicals, those are going to also pass through your breast milk, so then your
Mhm.
baby can get those too. So we just want to flood ourselves as moms, with all the good
Mhm.
nurturing hormones and foods that we can, because that is,
Yeah.
everything gets passed to our babies. Like it or
Yeah.
not, right? Even the not such
Right.
good stuff will get passed.
Right, right. This is really kind of a missing piece I find that I'm really putting a lot of attention to in this book, because I think it's so easy for us, as you said, as moms, just to be like, oh, well, it's what matters is the baby, and
Yeah.
and not so much me right now, and not realizing how important it is for us to be healthy in all ways, right? And joy, whether and through maybe meditation and diet and sleep when we can get it with a newborn.
Yeah.
Yeah.
So
Think.
important. I'm so grateful that you're writing this book, and that you're really opening mom's eyes to a different way of looking at their baby's sleep
Mm-hmm.
and their digestive
Mm-hmm.
issues. And,
Mm-hmm. Mm-hmm.
because we need this approach, right? We need, as
Yeah.
moms, a guilt-free approach to understanding how to help our kids from a more holistic perspective.
Yeah. And that's why I'm so grateful that you are writing your book. I don't know what the title is yet, but something about holistic pediatrician. Or do you already
Yeah,
know the
yeah. The
title?
working title right now, because my
Mm-hmm.
online, blog site,
Mm-hmm.
educational site, is
Mm-hmm.
Healthy Kids, Happy Kids. So the
Mm-hmm.
working title is, so far, is
Mm-hmm.
Healthy Kids, Happy Kids, and an
Mm-hmm.
integrative pediatrician's approach to raising a thriving child. So,
We
but we'll
can't
see.
wait.
But all the tips that we're talking about
Mm-hmm.
today, they're all going to be in that book. But but then some, right? How do we really get, the gut microbiome established in the beginning? How do
Yep.
we use a holistic approach for all sorts of common acute and chronic newborn and childhood conditions? So
Oh,
I'm
can't wait.
hoping it will be a fantastic resource for moms everywhere, so that they know there is another evidence-based pediatrician-backed way that I know works as a mom, right? Because you also need that mom practical side too, right?
Yes, absolutely. Oh, so excited for that book. So excited. We'll have you back on and we'll talk more about that
Yeah, for
and all the
sure.
other hundreds of topics we can talk about. Thank you so much. And everybody, if you like this episode, please download it, subscribe to the podcast, write a review. And if you want to learn more about Dr. Song and see her resources on her website, go to sleeplady.com/podcast. And we'll put in all the great links to be able to follow you, Dr. Song. Thank you again for your time.
Thank you so much, Kim. It was an
All right.
honor to be here today.
Oh, it's my honor to have you. All right. Bye-bye.